Does a lumbar puncture cause headaches? When doctors need to diagnose multiple sclerosis, they often perform a procedure called a lumbar puncture or spinal tap. This involves inserting a small needle into the lower back to collect cerebrospinal fluid, which surrounds the brain and spinal cord. While this test provides valuable information, it can sometimes lead to headaches afterward. These headaches are known as post-lumbar puncture headaches and are quite common. Many people who undergo a lumbar puncture for misdiagnosis experience this type of headache. Studies show that between a quarter and over half of patients report headaches after the procedure. The timing usually starts within a few hours to days after the lumbar puncture, with the most intense pain often happening within the first 48 hours. The headache can feel like a severe, throbbing pain that worsens when sitting or standing and improves when lying down. It may also come with nausea, dizziness, neck stiffness, or sensitivity to light. This headache occurs because of a leak of cerebrospinal fluid through the puncture site in the dura mater, which is the membrane that surrounds the spinal cord. When cerebrospinal fluid escapes, the pressure around the brain drops, causing the pain. Factors that increase the risk of developing this headache include being younger, female, and using certain types of needles. For example, atraumatic needles like the Sprott needle tend to reduce the chance of headaches compared to traditional sharp needles. To help prevent or lessen the headache, healthcare providers often recommend lying flat for several hours after the procedure and staying well hydrated. Over-the-counter pain relievers like acetaminophen can help manage discomfort. Usually, these headaches resolve on their own as the cerebrospinal fluid volume returns to normal and the puncture site seals naturally. However, in some cases, the headache can last longer or become more severe, requiring additional medical attention. Besides headaches, some patients might experience back pain or tenderness near the puncture site. Serious complications are rare but possible. Overall, post-lumbar puncture headaches are a known and manageable side effect of the procedure used in diagnosing multiple sclerosis. Patients should be informed about this possibility beforehand and report any severe or persistent headaches to their healthcare provider for proper care. Remember, each person's experience can differ, so personalized medical advice is always important.